Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today I'd like to address a common question I have, kind of a Dr. Google mythbuster. It's about abruptions, and I often have patients who come to see me and say, I'm having lots of belly pain in pregnancy. Am I having an abruption? And if you Google the question and some of your symptoms, it's certainly quite concerning. An abruption is where the placenta separates, causes some bleeding, can be life-threatening, very dangerous to you and the baby. So I'm not taking that lightly. I just want to reassure you that thankfully it's pretty uncommon. So we're going to talk about some of the common causes of abdominal pain, belly pain in pregnancy, and then we're also going to talk about abruption. But this video is not a diagnosis for you to determine whether that's what you have or not. I just want to give you a little bit more context, experience, and understanding of both. And whenever you're in doubt, contact your health provider. Okay, so when you're pregnant, your uterus starts to grow. As it grows, that causes some discomfort, some cramping. As it gets bigger, you can have something called round ligament pain, pains on the sides. Those are ligaments that go to your uterus and they stretch a little and can cause some discomfort as well. Furthermore, your intestines work a little slower during pregnancy. Your baby's asking you to eat more and there's less room in there. Add that all together, and plus more gas when you're pregnant gives you more indigestion. So you can have abdominal pain from that as well, okay? The other thing that happens is think of your pelvis as a bowl. Your uterus fits in that bowl, but around 18 weeks, the uterus is too big for that bowl and it kind of pooches out. That's when you start showing, and that can cause discomfort and really pull on your round ligaments, cause lots of discomfort as well. If you have that around that time and it's really bad, then getting on all fours like a cat and just relaxing sometimes can help take some of that discomfort off. The other thing that happens as you get further along in the second and third trimester is you start losing your belly button. So your belly button, your umbilicus, has some fascial tissue in there, and it starts stretching, and as it stretches, it can start to get micro tears, and you can turn an innie into an outie. That can be quite dramatic and quite uncomfortable. So that can be sharp pains around your belly button. As you get even further along, your rectus abdominis, the six-pack abs that attach up here to your ribs and goes down to your pubic bone, those separate a little bit, and that can cause some discomfort. And also they can pull on your ribs, and your ribs, as your belly gets bigger, starts to separate, and that can cause some discomfort too. As you can see, all these changes, they can lead to lots of discomfort. Abdominal discomfort, rib discomfort, back discomfort, okay? If you just take a bowling ball and tape it to anyone, a man, and put it on their belly, they're gonna have back pains, posture pains, some discomfort. Okay, so now let's talk about an abruption. Separate, different. Can it cause discomfort? Yes. What are some of the risk factors for it? Well, getting trauma, hit in the belly, okay? Fall down some stairs, get hit by a baseball bat or something, dramatic car wreck. Those can cause abruptions. And that trauma can cause the placenta to separate from the wall of the uterus a little bit, cause some blood, and that blood irritates the uterus and makes it contract. And you can have lots of contractions, and those can be uncomfortable. And usually, but not always, you have some bleeding with it. Not a tiny bit of spotting, but you can, but heavier bleeding. There are some drugs that can increase the chance of abruption. Commonly, crack cocaine is something frequently linked to abruption. There's an increased risk of abruption if you smoke. That's why we really encourage you to avoid smoking during pregnancy. Does it happen in all smokers? No. But I can tell you, in my experience, whenever a woman has an abruption and has no trauma, didn't fall downstairs or anything like that, 90% of the time they're a smoker. Okay? So that's a dangerous circumstance. And can it happen with no risk factors? Yes. So if you're having all of those other discomforts we talked about during drink some fluids, eat smaller amounts, change position, try some Tylenol, do some maneuvers. But if you're having more serious consequences and you're real concerned about that, you need to contact your provider. And remember, I've given you some context, some general information, but now you go to your physician and ask them, do I have higher risk factors or less? If you smoke, you have a higher risk factor. If you have a blood pressure problem, you have a higher risk factor if you're overweight. So there are additional risk factors for this, but thankfully, abruption is far less common than all those other causes that most older women have. I hope you found this useful. Please leave your comments. Thank you.